Hello everyone, my name is Tan Jing Teng and my partner Chua Li Jin would like to present our research topic, a system dynamic simulation for hospital bed utilization in hospital service. For introduction, hospital is a place that provides medical, surgery treatment and nursing care for sick and injured people. Hospital beds are especially designed for hospitalized patients or someone else who needs some form of health care. Hospital beds are important due to easy of transferring. It allows the nurse to adjust the height of the bed and to make it easier and less painful to move the patient into a seat posture. Next, for the problem statement of research, the hospital capacity planning is a major concern in many industrial and developed countries due to rising inpatient care expenses, limited resources, and rising demand for hospital care. This study was conducted to identify the utilization of hospital beds and the factors that affect the utilization of hospital beds. To increase or decrease the utilization of the hospital beds, the number of patients have to increase or decrease. Besides that, to increase or decrease the utilization of the hospital bed, the effort is to maximize patient care or minimize patient care. Next is for our objective research. The first one is to determine the factor that influence the utilization of hospital bed. The second one is to develop a system dynamic model to analyze utilization of hospital bed. The third one is to conduct intervention to increase or decrease utilization of hospital bed. There are 5 stages of the system dynamic modeling process, such as problem articulation, formulation of dynamic hypothesis, formulation of simulation model, testing, and policy design and evaluation. For the first one, problem articulation, in this stage, the researcher will define the model purpose and key variable and set the time horizontal. For the second one, formulation of dynamic hypothesis, the researcher will develop the working theory to show the linkage of the main variable. A causal loop diagram will be built to identify the cause and effect of the variable in the system through the feedback loop. The third one is formulation of a simulation model. In this stage, the researcher will transform the causal loop diagram into stock flow diagram using the Benzene software. The fourth one is testing. In this stage, the researcher will test the structural validation and behavior validation of the model, which are comparing the historical data and the data that modeling benzene product produced is same or not. The fifth one is policy design and evaluation. In this stage, the researcher will seek for the model improvement and using the best and worst case scenario and optimization. This diagram is our causal loop diagram for our research. The next one is stock flow diagram of our research. For the data collection, the secondary data which has published on the official portal of University of Malaya Medical Center, the researcher will collect the data of bed occupancy rate, bed turnover interval, and average length of stay. For this slide, this is the graph that I will collect from the official portal of University of Malaya Medical Center. This have bed occupancy rate, average length of stay, bed turnover and turnover interval, data. Next, I will pass to my partner Charlie Ching.
Thank you, Cheng Teng. Good day to Doctor and everyone. My name is Charlie Ching, mission number 265494, and now I will continue the presentation with the reference mode. Our group have used the inpatient as our reference mode, and this historical data we have obtained from the official website of University of Malaysia Medical Center UMC, and we will use this reference mode to determine the behavior validation of our model. So based on the graph on the right hand side, we can conclude that the behavior validation of our model is valid because the gap between the simulation data and the real data is not far away. And next is the base model. Since our objective is to identify the utilization of the bed in the hospital, so our base model will be the bed occupancy rate BOR. From the graph, we can see that the BOR is increased slightly in every year, but is still maintained at around 70% to 75% in every year. And we will continue to the intervention. For our first intervention, we have increased the admission rate to the 10%. From the graph, we can see that the admission patient after intervention have a large increase compared to before, which had increased more than 50% in every year. And for the second intervention, we have decreased the discharge rate to 50%. And from the result, we can see that the discharge of recovery after intervention have decreased to 48% in the beginning, which is the year 2015. But the gap between the simulation result and the intervention result had become smaller and smaller in every year. For the result and discussion, the bed occupancy rate BOR for the simulation data are maintained at 70% to 75% in every year. And for both of the intervention data, they also maintain at 70% to 75% in every year. And based on the graph, we can see that the line for the simulation data and the line for the both intervention data are almost overlapping. Lastly, for the conclusion, we can conclude that the University of Malaysia Medical Center UMC was operate in the good condition, and by conducting the intervention, we can see the UMC still can operate well in different situations, and we believe that UMC can provide enough of beds to patients neither in normal situation nor the critical situation, especially during the COVID-19 pandemic, which had spread widely and unstable in Malaysia. That's all from us. Thank you.